The PPDA deserves support because it has brought together the most experienced clinicians and practitioners from across the United States and in many cases around the world to develop resources for patients, for medical clinicians, for mental health professionals that will elevate the level and quality of care in this field better than anyone else out there. And the more support that we get, the greater our reach can be. Donations to the PPDA are intended to improve our ability to communicate with medical and mental health professionals and health insurers to make a difference in the United States and around the world in the quality of care and the outcomes of people who are suffering from this condition. Remember that we're talking about 1 in 6 adults suffering from psychophysiologic disorders, with neither medical clinicians nor mental health professionals typically having any formal training in how to diagnose or treat this condition. Imagine if no one knew how to diagnose or treat diabetes. What a travesty that would be for patients and for the healthcare system and for costs. And we're talking about a population of patients that's 60% larger than the diabetic population. So providing support to the PPDA enables us to get our message out, our training out, just the basic idea that stress is capable of causing real physical symptoms. Even that simple concept has not been addressed typically by the healthcare system. That needs to change. The PPDA will stop at nothing to educate medical professionals and the public about this condition, because it's not complicated, but it is profoundly impactful. So we have financially supported a randomized controlled trial of the methods that we teach in a population of back pain patients. We're very excited about the outcome of that study, which included functional magnetic resonance imaging of the brain in people who are suffering back pain. So that's going on. There are two documentary films in addition to one that's already been released, but 2 more documentary films that are in production that we're very excited about that illustrate these methods, one of which is about the randomized controlled trial. We have a multi-author international textbook in the works that's bringing together expertise from around the English-speaking world to educate people who are new. I would have loved to have that textbook when I was starting out in this field, so I wouldn't have had to climb that 4 or 5 year learning curve that caused so much pain back in the 1980s for me. We've got YouTube videos that are for training and for public education coming out all the time. So lots and lots going on, and with support we can do even more. Anyone who supports the PPDA immediately joins the team that is trying to effect this transformation. I mean, again, this is the biggest blind spot in the healthcare system. This is the single largest source of unnecessary human suffering that I know of. And people who support us are giving their support to the most experienced clinicians, the best teachers, and putting their dollars behind education in a variety of forms that's going to make a huge difference in closing this blind spot. All of us who work in the PPDA have seen in our own practices the absolute transformation of patients' lives. We not only relieve their symptoms, but we help them personally in their lives as well. The 2 areas of improvement go hand in hand with each other. So the transformation of people's symptoms and their lives is absolutely possible. We see it in our practices on a daily basis. And the more support that we get, the more we can bring these kinds of outcomes to everybody. And it's going to make a huge difference. So we'd love to have people join us in doing that.